Thank you for watching this video on the mentor-mentee relationship provided by the Utah State University Dietetic Internship. Over the course of this short video, we will discuss the unique aspects of mentoring dietetic interns, how to build a successful mentor-mentee relationship, and how to help your interns build confidence during their rotation with you. Let's start with a reflection. How has a formal or informal mentor-mentee relationship helped you in your career? Have you participated in any training programs on mentoring dietetic interns? And if so, what are some of the key principles you remember? Hopefully, as we go through this video, your answers to those questions will serve as a great foundation to build on. Mentoring versus coaching. Mentoring and coaching are often used interchangeably, but the two concepts have different motives and methods. In coaching, the coach determines the path and is focused on the end result. The coachee doesn't have much of a say. In mentoring, the mentor helps the mentee determine the results and the steps necessary to achieving them. As a preceptor, you will have the opportunity to help dietetic interns develop professional skills in addition to the skills and knowledge they have already gained. Let's focus on the first column of what mentoring is. Mentoring is modeling professional goal setting and achievement. Preceptors act as a professional example for dietetics interns. The intern will form many of their professional opinions, routines, and behaviors based on those modeled by you and other preceptors. Supporting and empowering. Preceptors help interns recognize their strengths, and when an intern isn't so sure of their abilities, sometimes the preceptor is a cheerleader as the intern takes on a new or challenging task. Mentoring is teaching and guidance. Preceptors teach interns about their positions and help the intern build a foundation of knowledge to develop competency and pass the RD exam. If interns had learned everything they needed to know during their DPD program, they wouldn't need supervised practice. Mentoring is giving constructive feedback. Preceptors gently correct and guide interns. Preceptors should not be afraid to have conversations with the intern about knowledge or performance deficiencies or unprofessional behavior. Mentoring is introducing your intern to professional opportunities. Preceptors can encourage interns to explore their interests and learn about organizations they can rely on for professional development. Mentoring is recognizing success and growth. As a preceptor, when you recognize the successes of your intern through verbal and written statements, your intern's self-confidence grows. While you work with interns, strive to exhibit the behaviors listed on the Mentoring Is side of this list. If you find yourself struggling with an intern, take time to reflect on your mentoring style and any opportunities for adjustment. Setting yourself up for success. A poorly planned and unstructured mentoring relationship will be a poor experience for both involved. During the first meeting, the roles for the preceptor and the intern should be defined. Discuss the goals of the rotation, expectations, and how you plan to help the intern achieve them. Here are some suggestions for how that first meeting between you and your intern should go. Set clear expectations for performance and progression. Clear expectations will help your intern know if they are progressing as expected and will help avoid any confusion about how the intern should conduct themselves during the rotation. Early on, you and your intern should discuss expectations for communication. The frequency of communication will vary depending on the rotation. If you want an intern to check in with you on various projects and tasks that you have assigned to them, tell them. This will avoid frustration and prevent the intern from moving forward with a project without your approval. The internship will provide the intern with a list of tasks to complete during the rotation. It is recommended that you take the time over the first few days to read through the materials provided and let the intern or internship know that you have questions. If you have extra projects and tasks you would like to assign, then discuss those early and together you and the intern can determine if they will be able to manage their assigned tasks and the extra tasks without affecting their performance. Share the interesting and unique aspects of your position and facility. This can help the intern determine if this area of dietetics is something that interests them and develop a positive working relationship with you. Now we will discuss some suggestions for building intern confidence. Setting goals is similar to being clear about expectations. This should be done at the beginning of the rotation. If both you and the intern are aware of the goals of the rotation, they are more likely to be achieved. If the intern doesn't have any goals, ask them to come up with goals by a specific deadline. Start with shadowing. Every intern enters the internship with different backgrounds. For example, some interns have spent time working in hospital settings, and for others, the first time they enter a patient's room will be with you. Allowing the intern to shadow you as you work helps them learn your routine and develop their own. If you are in a school district or other food service kitchen, allow the intern to observe you as you check in with your employees or as you respond to employee concerns. Many interns know what it feels like to be an employee, but they don't have a frame of reference for the management side. As the intern observes you with patients, clients, employees, and peers, they can start to build on their own didactic knowledge. When you assign tasks, be specific. Explain to them why this task is important and your objective for the outcome. Specific instructions give the intern something to rely on so they don't have to come to you with each question they have. If this task involves the intern communicating with staff, give them advice on how to do that. Or if you need to review the work before it is shared, let them know that they need to talk it over with you. Interns are learning the processes as they go along, and specific instructions will help them be successful. Schedule time to reflect on experiences. This does not need to be a daily occurrence, but can be done periodically throughout the rotation. By scheduling time to reflect on the patients seen, meetings attended, or the problems solved, the intern will build self-confidence necessary to work independently and gain insight into how to approach these situations in the future. As the rotation progresses, take time to have an informal check-in with your intern. This will give you both an opportunity to discuss what is going well and what isn't. Ask for their thoughts on their improvement and their skill development. Are they on track to achieve the goals they set at the beginning of the rotation? Do you need to discuss steps for improvement? This informal check-in will allow you both to discuss any concerns, and then you can determine a plan for how to address any deficiencies. Last, share your experiences as a dietitian. Some topics to discuss include: what did you find most helpful as you studied for the RDN exam? What did you find most helpful as you searched for your first job? Share your advice on networking, professional organizations, and what has helped you most during your career. These discussions will help build trust and help your intern get ready for their professional life after the internship. Challenges in the mentoring relationship. Occasionally, situations develop that require both the intern and preceptor to take a step back and adjust their perspective. Avoid comparing interns to each other. Remember that they enter the internship with varied backgrounds. You may be a young preceptor working with an older intern, or vice versa. In this situation, you may have to have more discussions about roles and what autonomy the intern has or doesn't have. You may have to encourage a younger intern to be more assertive when talking to colleagues who are older and have more authority. Personality clashes may arise. You may be more extroverted and be working with an introverted intern. Sometimes these interns may appear to be disengaged or uninterested. It may require you to adjust your precepting style to ask more questions or give them a little extra time to warm up to you. You may work with an intern who has only lived in the United States for a short time. If they miss social cues, take the time to explain why their behavior might be affecting their success with patients or staff. Differences in work ethic and style. You may work with an intern who isn't putting in enough effort from your perspective. This may be the first time they've done the task assigned, so take the time to discuss what you expect and provide examples. Be honest with them and let them know what you're thinking. They may be nervous about working independently and making a mistake. If their work does not improve, it would be appropriate to involve the dietetic internship faculty. At any point of the rotation, if your efforts to correct and provide guidance to an intern are unsuccessful, do not hesitate to contact the internship faculty. Serious issues like unethical or unprofessional behavior should always be shared with the DI. We rely on your feedback and can help resolve disagreements and frustration. As dietetic internship faculty, we have found that when problems such as these arise, open and honest communication is the best way to come to a solution. What do you get out of the experience as a preceptor? This is an important question. Increased job satisfaction is a common outcome backed by numerous studies conducted over the years. If you are a manager of dietitians and have some dietitians who seem disengaged, precepting can help rekindle their love of dietetics and their career. Dietetic interns are full of new ideas. Because of their recent undergraduate education, they can share new research with preceptors or help preceptors master new technology. Preceptors have also reported that the excitement interns possess has encouraged them to set and achieve goals for professional development. As you precept interns, you get to help transform their lives, and that is a great reward. Final thoughts. While dietetic interns are eager to learn and apply their knowledge of dietetics in their various rotations, most will also have some concerns about their level of preparation and ability to perform adequately as an intern. The essence of precepting is the individual relationship between an experienced and expert professional and an educated but inexperienced intern. As a preceptor, you will incorporate a variety of strategies and activities to help the intern grow and develop in professional competence, attitude, and behavior. As you provide positive reinforcement, correction when necessary, and opportunities to step into the unknown, you will help your intern successfully transition from a student to a professional. Thank you for taking the time to watch this video on mentoring dietetic interns. We hope that your experience as a preceptor for the Utah State University Dietetic Internship is gratifying to you, and we look forward to working with you over the years.